So I'm happy to be here to talk to you about some of the work we've done. And it kind of can be an opportunity to kind of dive more into the trenches, since I'm sort of like in the trenches here, as they say, on this work, really since March, on all these COVID relief packages, as Ms. Johnson was articulating just a few seconds ago. So first, thanks for inviting me. Happy to be here to talk to you all about my favorite topic, which is nutrition assistance. I also wanted to note that I used to work at FRAC, used to work at USDA. I have a long history in the nutrition work. So I just wanted to share that. So I don't want to sort of repeat some of the things that Rep. Johnson said, but I kind of want to give a little bit of context to some of the items that she mentioned. So you guys know, as anti-hunger advocates, you all understand that even as the Congresswoman would say, as one of the most powerful countries in the world, we're still a nation struggling to feed all of its citizens. And the coronavirus pandemic further increased the prevalence of hunger in America. We had unprecedented wage cuts and widespread job losses, which made putting food on the table much harder for people in need across the country. One important stat that I want to raise is that really since the pandemic, some 6 to 7 million people have joined the SNAP program. So I think that number is continuing to grow. We're still waiting on updated numbers from USDA just to sort of wrap our heads around the full impact of this pandemic. But just wanted to share that data point. We're continuing to monitor, what caseloads are looking like in my boss's district, in Cleveland and in Akron, Ohio. So to address the immediate food needs of hungry people across the nation, we took immediate action. On March 8th, we did pass the Families First Coronavirus Response Act, and the bill provided so many great things in the nutrition space. I'm still shocked when I look back at all the work we did on that legislation as to how much we were able to get in there with really relative ease and very, very little pushback from our Republican colleagues. So the bill provided states the flexibility to streamline SNAP operations. It provided emergency SNAP benefits up to the maximum allotment for their household size for those that are not already receiving the maximum allotment. It suspended work requirements for able-bodied adults without dependents. Granted USDA nationwide waiver authority to provide greater flexibility in the school meals and WIC operations. It established a new pandemic EBT cash assistance program for children impacted by school closures. These are children who would have otherwise received free or reduced price meals if it wasn't for the closure of their school. That was born out of legislation that was led by Congresswoman Fudge in collaboration with the House Education and Labor Committee Chairman, Bobby Scott from Virginia. So that's a very proud program and proud initiative for Congresswoman Fudge. So the Families First Coronavirus Response Act also provided an additional $400 million for food banks to distribute emergency food. So a few weeks later, we passed the CARES Act. And that bill provided some $24 billion to help states sort of cover the cost of rapidly rising enrollment in the nutrition programs. And then it provided some additional money for food banks, some $450 million on top of the $400 million that we provided in the Families First Coronavirus Response Act. But after passage of the CARES Act, people are still hurting across the country, and the need is just continuing to grow. And so Democrats in May passed another comprehensive package known as the HEROES Act. So this package included a boost to SNAP benefits by 15% in the maximum allotment. It raises the minimum SNAP benefit from $16 to $30. It suspends mandatory SNAP E&T requirements, allows SNAP participants to purchase hot foods at authorized grocery stores. That's a topic I hear about a lot, and one the Congresswoman is very supportive of. and it blocks USDA from moving forward with its harmful SNAP rules. I'm sure you guys are all familiar with the rules that have been published over the course of the last year. So that would altogether cut about 4 million people off of the SNAP rules. So the HEROES Act also extended pandemic EBT to include children under 5 impacted by childcare closures. It expanded the program to include the territories, added some additional administrative money, really covered the full cost, the admin cost for pandemic EBT at that time. We were hearing that states were still having trouble with the operating costs associated with launching pandemic EBT. So we wanted to make sure that was a non-issue. It also provided formula funding to schools to cover school meal revenue related losses. And provided food banks an additional $150 million. There were some delays in food distribution to food banks and funding through TFAP. So we wanted to make sure to continue to provide additional funding for food banks, who were really the lifeline during this pandemic. But unfortunately, our colleagues in the Senate refused to act. And so additional nutrition assistance wouldn't come for another 5 months. So in that time, we were really scrambling and hearing from state agencies across the country who were preparing for those existing emergency nutrition assistance that we provided in the Families First Coronavirus Response Act to sunset on September 30th, 2021. Those are the SNAP flexibilities, the Pandemic EBT Authority, the flexibilities we provided via school meals and WIC. All of those things were getting ready to sunset at the end of the fiscal year. And so we put our heads together, and with the support of House leadership and the Agriculture Committee, the Education and Labor Committee, the Appropriations Committee, we recently passed, this was just last week, a continuing resolution to fund the government through December 11th. So that measure includes an extension and expansion of pandemic EBT, yay, which is great. And so that expansion includes kids under 5, that includes the territories, that includes that additional administrative money. So 100% of the costs are covered as it relates to pandemic EBT. And we, in that funding measure, we also extended critical WIC and school meals flexibilities through the fiscal year. So again, those are all things that we were happy to see move. Along with that, it extends the ability of states to streamline SNAP operations. That also was born out of legislation that was led by Congresswoman Fudge, and the president signed it. So those are all, important emergency nutrition measures that we were able to get through, and we worked together in a bipartisan way to get that done. But I want to be clear about one thing, that, and this is something that the Congresswoman has said since passage of our funding measure, is that this is legislation to fund the government. Yes, we were able to successfully add on nutrition provisions that were getting ready to sunset at the end of the fiscal year, but this by no means replaces a comprehensive coronavirus relief package. So I want to make that point clear. So that is why you guys may have seen that last night we passed a sort of a pared down or updated version of the HEROES Act that I described a little minute ago. We're still in the process of negotiating with Republicans to try to get a bipartisan deal done to get more relief out to those, millions of Americans who are adversely impacted by this coronavirus pandemic, and also to just address, pandemic-related needs in states across the country. So last night we passed what we're calling HEROES 2.0. So in HEROES 2.0, it includes pretty much most of the nutrition provisions that were in the original HEROES Act. That's boosting the SNAP maximum allotment by 15%, increasing the maximum benefit from $16 to $30, It suspends SNAP, the time limits for able-bodied adults, that 3-month time limit for able-bodied adults without dependents. It provides $300 million in funding for states for SNAP administrative expenses. It also provides that college students cannot be barred from accessing SNAP based on the lack of work study and work opportunities. That, again, is another initiative, another bill, another measure that was born out of legislation that was led by Congresswoman Fudge. It also excludes the pandemic unemployment compensation from being counted as income for the purposes of SNAP eligibility and benefit level determinations. It also provides relief through the Child and Adult Care Food Program. It also, gosh, the list goes on and on. Provides additional relief for food banks through TFAP. It's $450 million, $400 million for WIC, and some flexibilities within the food distribution program on Indian reservations. So those are all great things. Again, you know, it's important to note that while we pass that bill, for us, this is really a way to show our Republican colleagues that we're serious about coming to the negotiating table and coming up with a bipartisan deal, and bringing forth a starting point where we feel like is a good place where we can really come up with something that we can pass and get out relief to the American people. So that is the bill that passed last night in the House, and you know, hopefully more to come on that. Congresswoman Fudge is all over all of these nutrition provisions. We are constantly in contact with our committees and leadership to see what else we can do, what else we can get into all of these relief packages, ones that we've considered and those that are soon to come. So just wanted to note that. As for the future, Congresswoman Fudge is, you know, really focused on figuring out ways to provide relief to farmers and incentivizing them to donate leftover food to food banks. I think we want to continue that. We've heard from food banks around the country that experienced reductions in food donations, and so that is a concern, and that is not something that our food banks were not immune to. So we're listening to them. We're also thinking about a future child nutrition reauthorization bill and a future farm bill, and how do we maybe give some permanency in the authorities here as it relates to, you know, USDA already having existing authorities to make some of these calls without Congress stepping in, but within reason, right? I think we in Congress still want to have some level of say in what happens in a future pandemic. But again, you know, we're all about trying to figure out ways to get out relief quicker. I think this pandemic has also caused us to really look at the nutrition programs differently. I was just having a conversation with some retailers recently, and we were talking about hot foods. The issue of hot foods is something that my boss supports, especially during times of disasters, but also during this pandemic. She's voted several times in support of, you know, a temporary allowance for the purchase of hot foods at authorized retailers. You know, for her, it's multifaceted. You know, we should be looking at the number of people that are being impacted by evictions and foreclosures, and perhaps there is a large population of people who don't have a consistent place to cook and prepare meals. And, you know, SNAP is built as a program for the purchase of food for home consumption. So how do we look at that, and maybe that's something that we try to address in the next farm bill as it relates to hot foods. Also, pandemic EBT, you know, we're thinking about this as a program that is somewhat of a replacement. I mean, kids can still access food at, you know, schools when they make the meals available via grab and go or at other, you know, pickup sites. But, you know, kids want a hot meal. And so if pandemic EBT is being run out of the SNAP program, perhaps again, that's another reason why we need to be looking at hot foods maybe in a different way. So I think we're still continuing to look at, what makes the most sense for future, authorizing legislation in both the school meals and WIC and in the SNAP space. But for the Congresswoman's part, we're just continuing to work, and the work doesn't stop. You see bills pass, we continue to work. And, I thank all of you for the work that you guys are doing, the work of those panelists on this call. Some of you guys I work with regularly, so thank you for the work that you guys do. And, we'll continue to do our work. The Congresswoman thanks you for the work that you guys do. And thanks again for having me here today. And I'm available anytime. Anybody can look me up if you're interested in chatting with me about the work we're doing here in Congress on the nutrition programs. And
thank you for your introductory remarks. I think that you set the stage well for our conversation this morning, and so appreciate your introductory remarks, as well as Congresswoman Johnson for her remarks as well, and for being part of the conversation, and for representing a Congresswoman that is doing the work on the national stage to reduce food insecurity in our nation. To move us forward on our agenda, I would like to now move forward with just thanking our participants today. And I'm excited to know that there's so many people that are interested in the topic of public policy, and look forward to having an engaging conversation later today. I would like to thank a couple of key sponsors and notable organizations that have contributed financially to make this event possible. Thank you to the Dallas Baptist Association, National Council of Jewish Women of Greater Dallas, North Texas Food Bank, United Way of Metropolitan Dallas, and the Episcopal Diocese of Dallas for making this event possible. Your continued partnership for this event makes it possible to educate, equip, and energize allies to advance food equity and security for our neighbors. Without further ado, because I think this is where the meat of the conversation will come from, and what everyone's kind of been waiting for, is a very awesome panel that is being moderated by our very own Sarah Albert. The topic for today will be post-pandemic, rebuilding with more equitable food policies. The COVID-19 pandemic has stunningly revealed the vulnerabilities of our food, economic, and healthcare system in America. And so while our leaders are scrambled to address the numerous challenges faced by Americans as a result of the pandemic, many of whom had never struggled before, it became abundantly clear that adjustments to our federal and state food and nutrition policies were needed to help families and individuals weather the storm. So today, Sarah will be leading a discussion with our panelists. Sarah is a food law and policy expert and member of the leadership team of the Dallas Coalition for Hunger Solutions, as well as the co-chair of the Public Policy Action Team. So I'll pass it on and give her the virtual stage so she can introduce our panel today of distinguished speakers.
Great. Thank you, Denise, and good morning, everybody. I'm so happy to see so many participants and appreciate you all hanging in there with us. And I really appreciate hearing from Congresswoman Johnson and from Ms. Garrison, who set the stage on where we currently find ourselves with legislation that has passed, that will pass, that will continue to weather this pandemic. Our program today, we're honored to have 3 expert panelists, each bringing their own unique professional experience and perspective to addressing the challenges of hunger and food insecurity. And they will help us explore how the impact of COVID can and indeed should be a catalyst for strengthened and enlightened policies, whether federal, state, or community-based, that can play a role in rebuilding our communities into stronger, healthier, and more equitable places. For our format, we'll hear from each of our panelists, followed by some discussion questions among the panel. We will do our best to leave some time at the end for questions from the audience. We started a little late, and we're trying to catch up as quickly as we can to end on time. Please post any questions you may have as they occur to you in the Q&A, not the chat. In the Q&A box, there's a lot of chat going on. It'll be easier for us to monitor if your questions are solely in the Q&A box. Now it's my pleasure to introduce first Josh Protas. Josh is the Vice President of Public Policy and heads the Washington, D.C. office for Mazon, the Jewish Response to Hunger. Mazon is a national advocacy organization working to end hunger among people of all faiths and backgrounds in the United States and in Israel. In his role, he coordinates and implements Mazon's advocacy agenda, including efforts to protect and strengthen the Federal Nutrition Safety Act, or safety net, with particular emphasis on food insecurity needs of seniors, veterans, and military families. Next, we'll hear from Jennifer Craig. Jennifer is the Assistant Director of Nutrition and Menu Operations for the Garland Independent School District. Prior to assuming this role in 2014, Jennifer was the Operations Training Supervisor at the district for 4 years. Jennifer's career began in the restaurant industry, and during those 15 years, she focused on operations, catering, training, and public relations. Jennifer is an active member of the Texas School Nutrition Association, and American Commodity Distribution Association. And then our third speaker, Dr. Hussein Lalani, is an internal medicine resident physician and public health advocate in Dallas. He's focused on data-driven, community-based interventions and policies to address the social determinants of health. Dr. Lalani has worked domestically and internationally to understand food insecurity, and he is a frequent opinion contributor to the Dallas Morning News. And with that, I'll turn our program over to Josh.
Great. Thank you so much, Sarah. And thank you to the Dallas Coalition for Hunger Solutions for putting this excellent series together. It is a very tough act to follow, Congresswoman Johnson and Yang Garrison. I just want to thank Congresswoman Johnson and Congresswoman Fudge for their amazing leadership. And one of the things I'm going to be talking about is a contrast in leadership. During this moment of crisis, it's when we need leadership most. And I think we've seen some amazing examples of that and some stunning examples of failure to lead where it's needed. And want to just give some special recognition to Yang Garrison and to congressional staff who work so hard behind the scenes. They're really among the heroes on the front lines. And with the legislation that Yang detailed, I mean, that takes tremendous work to make that happen. Tremendous expertise, as you heard from her. We're so fortunate to have such skilled staff working tirelessly, especially at a time like this during the pandemic. So the COVID-19 crisis has shined a spotlight on the gaping holes in our nation's safety net. And at Mazon, a Jewish Response to Hunger, we've been firing on all cylinders, working to ensure that Americans can feed themselves and their families with dignity. Grounded in the strong foundation of our Jewish values, Mazon continues to call attention to the disparate impact of COVID-19, and in particular, as Sarah mentioned, on populations whose food insecurity challenges have long been overlooked, including military families, veterans, Native Americans, older adults, and LGBT older adults, college students, single mothers, and those in rural and remote communities. I'm gonna share my screen, and I'm gonna try and talk in broad strokes. Let me find the presentation here. In broad strokes about these issues, and look forward to a robust conversation during the discussion. So to start, I really want to ground things in what the human impact is. So often we talk about food insecurity and hunger in terms of statistics, and certainly in the context of COVID-19, the statistics are overwhelming. But I want us to stay focused on what this means at the individual level. Mazon worked with a photojournalist a few years back to gather stories and take pictures of a diverse range of Americans who struggle with food insecurity. So just want to share a bit from Blanca's story. So Blanca lives in Santa Fe, New Mexico, and was 14 at the time that she spoke with us. Blanca's words are, "We get food stamps once a week, and we get extra groceries and dinner at our school. It's hard to make our food stamps last a whole month with 3 kids. Kids eat a lot. At first, we made a lot of mistakes with our food stamps and used them up before the month was over. But we've learned how to budget ourselves, and I use self-control not to eat a lot. My mom doesn't tell me not to take food, but I ask myself, am I really that hungry? I worry about food, but I know it's harder for my sisters. They are kids. Blanca, she's 14 years old. She should never have to think about using self-control about food that she eats, or be in a position where she has to kind of blame herself for mistakes in making food stamp dollars stretch till the end of the month. We have a gap in dignity in this country, and we have a long way to go to make sure that people like Blanca have a better future and don't have to unnecessarily struggle during these circumstances. I wasn't planning to do this, but I just want to share a quick message of hope, because I know so much of what we're dealing with is so difficult in the COVID context, the health crises, and in a very challenging political environment where these programs that should be common sense to support and strengthen and improve are instead under attack. So this is a letter I keep in my office that I read periodically just to bolster myself. It's a letter from E.B. White, who wrote Charlotte's Web, among other things, in 1973 in response to a letter from a reader who was feeling dejected. He wrote, "Sailors have an expression about the weather. They say the weather is a great bluffer. I guess the same is true of our human society. Things can look dark, then a break shows in the clouds and all is changed, sometimes rather suddenly. It's quite obvious that the human race has made a queer mess of life on this planet. But as a people, we probably harbor seeds of goodness that have lain for a long time, waiting to sprout when the conditions are right. Man's curiosity, his relentlessness, his inventiveness, his ingenuity have led him into deep trouble. We can only hope that these same traits will enable him to claw his way out. Hang on to your hat, hang on to your hope, and wind the clock, for tomorrow is another day." So want us to feel encouraged that we're going to get through this and we're going to be in a better place. So moving on, just want to share that the resource of Blanca's story and other stories like hers can be found on Mazon's website, mazon.org/thisishunger. We have a video presentation of these stories and curriculum materials. So if that's something that's helpful for any of you as you engage your communities about these issues, it's a public resource and we welcome you to use those. One thing I just want to emphasize is the critical importance of federal nutrition assistance programs. We've unfortunately moved in this country to a place that's much more a charitable response, or at least the perception is that it's a charitable response. And the truth is that less than 10% of food assistance in this country comes from the charitable sector, from all of the food banks and food pantries and the churches, mosques, and synagogues that help to provide food to those who are struggling. So any even small cut or harmful change to a program like SNAP has a massive ripple effect. And we've seen in the context of COVID that our charitable institutions are spread too thin. They don't have the resources. They were never set up to have the capacity to fully address the issue of food insecurity in this country, even in the best of times. And unfortunately, some of our policymakers would like to shift more of that burden onto the charitable sector. So want to just emphasize it. I know, one question we'll have later is about long-term hopes and visions. And I think it is incumbent upon us to push for greater support for our public programs. There's a disconnect in this country, and this is an image from long ago, but there's parts of it that still ring true. A disconnect between the image of the American dream and the reality for millions of Americans. This disconnect has to do with systemic issues, including racial injustice, where there's much greater recognition of that now, but long-standing racial injustice issues, social policies, and economic inequalities that contribute to this disconnect between the dream and the difficulty for so many of our friends, neighbors, and family members to reach that dream. So there's systemic barriers that we have to address that have long been ignored in this country. And one of the things that's incredibly helpful in addressing this gap are programs like SNAP. So we want to just go through quickly. This is not news to anybody who's on this call who recognizes the vital importance of SNAP, but just a few key pieces. And as Yang mentioned, we have the HEROES Act and HEROES 2.0 Act that have been passed by the House. Strong leadership recognizing that programs like SNAP are some of the most powerful ways that we can help to support those who are struggling and also help to get our country back on the right track during the pandemic. So there's clear economic impact of SNAP. Even conservative economists have recognized that SNAP is one of the most powerful government stimulus programs, with every dollar in benefits contributing $1.50 up to $1.80 in economic activity at the local level. So these are helping our local stores, our local merchants, as well as helping our local citizens put food on the table. We'll hear more from other panelists about the positive impacts on health outcomes, but just want to note at the personal level, low-income adults participating in SNAP incur about $1,400 or nearly 25% less in annual healthcare costs than low-income non-participants. And then the societal benefits for our healthcare and the savings. Studies estimate that food insecurity costs our country more than $160 billion annually in healthcare costs. That's money that we're throwing out the door because of short-sighted failure to fully address this issue at the public level. The challenges now, as we all know, are incredibly exacerbated during COVID. We've seen the images in newspapers and on the daily news of long lines at parking lots, long lines at food pantries. More than 1 in 10 adults were food insecure in this moment before COVID. And estimates are that that's going to grow to 1 in 6 as a result of the pandemic. And as many as 1 in 4 children in the US will be food insecure because of the pandemic. And let's just think about that. 1 in 4 children, 1 in 4 of the youth in this country may be struggling with food insecurity. That's just unconscionable. And in terms of the larger numbers, before the pandemic, it was roughly 37 million Americans who were struggling with food insecurity. And take a step back and put that into context, that's larger than the entire population of Canada. In the United States, the wealthiest country in the world, in the history of the world, when we allow that to happen, it's unconscionable. And it's unconscionable that we haven't been doing more. And by we, I'm really pointing the finger at the Senate and Senate Republicans in this administration who have balked at giving more assistance in doing the necessary boost to the SNAP program and other nutrition programs. Hungry people can't wait. They're hungry now. They can't wait to see what the impact of COVID is going to be for months. 10% of adults reported their household did not always have enough to eat. And as I noted before, there's a disproportionate impact on Black and Latinx households that are deepening the racial inequalities in this country. I also want to note that there's a lot of work to be done to close gaps in the SNAP program. So SNAP is the most powerful anti-hunger program that we have. It's the cornerstone of our federal assistance program. And yet it's not reaching everybody who needs that help. Some of that has to do with shame and stigma and misinformation. And I think a really problematic public perception about assistance programs, and we'll talk a little bit more about that. But some of the populations where there's a SNAP gap that we have work to do to close are surprisingly veterans. A recent study showed that of veterans who are potentially eligible for SNAP, only 1 in 3 are participating. SNAP's a mandatory entitlement program, meaning that anybody who's eligible for the assistance can get that assistance. They're not taking the benefit away from somebody else. So that means that 2/3 of veterans who may be struggling are leaving those benefits on the table. They're struggling needlessly. Native Americans, really the demographic in the United States that faces the highest rate of food insecurity. And there's lots of systemic issues in Indian country. Mazon's done some leadership work with Native groups as an ally to really push for empowerment and food sovereignty that's deeply desired in Indian country. But there's a lot of work to close the gaps and address the needs in Indian country. We know that seniors participate at very low rates in the SNAP program. Even though there's been a lot of work to do SNAP outreach and that's improved, there's still a long way to go. And for particular parts of the senior population, including LGBT seniors who face some unique barriers and challenges, we need to do more. With a stunning 40% of single mothers in the US who are struggling to afford food for their families, these women are facing even greater challenges in the context of COVID. So there's a lot of work to do there. Yang mentioned that the HEROES 2.0 Act included a provision to prevent the loss of SNAP benefits for college students. So we really appreciate Congresswoman Fudge's leadership on that and Congressman Scott's leadership on that issue. There's been growing recognition of the food insecurity challenges for college students and barriers to participation in SNAP. And certainly in rural and remote communities that oftentimes don't get talked about. So food insecurity frequently gets talked about in the public discourse as a quote, urban issue that doesn't touch rural communities. And the truth is actually far different, that food insecurity exists sometimes at greater rates in rural communities. And I think those who ideologically have differences about public assistance programs like to use racially coded language as a way to disparage and draw support away from programs like SNAP in a way that's very dangerous and pernicious and mean-spirited. So we need to change some of the public discourse as well as changing the situation where some populations don't participate in programs. Yang mentioned the Farm Bill, and while the next Farm Bill isn't due until 2023, it seems like a long way off. Now is the time to start laying the groundwork to recognize where there are gaps, where there are opportunities to improve our programs. And just a quick overview, I love this graphic that was used during the last Farm Bill debates. Looking at the Farm Bill is like a Swiss Army knife, President Obama said, where there's lots of different provisions in it that help our producers, they help with conservation issues, with research. And the largest funding part of the Farm Bill is around nutrition programs. Unfortunately, the last Farm Bill that passed in 2018 was marked by deeply partisan attacks on SNAP with proposals to cut and make harmful changes. Unfortunately, because of leadership from Congresswoman Fudge and Congressman McGovern and others in the House and in the Senate, those harmful proposals were turned back. Unfortunately, what we've seen with this administration is that they've gone ahead in many ways against the express intent of Congress and have tried through administrative actions to push forward some of these harmful changes. So even though the final Farm Bill package didn't include these provisions that would weaken or cut SNAP, we're seeing some of that happen on the administrative level, and it's really required a lot of work and energy and effort by advocates to push back on that. Threats to SNAP, as I mentioned, the political dynamics around SNAP have shifted, not because of the changes to the program in any kind of way, but because of misleading public perceptions and the more extreme ideologies among some policymakers. So for sake of time, I'm not going to go through legislative attempts to undercut SNAP or the administrative changes. Yang mentioned a few, like making work requirements more strict and proposals to do away with the categorical eligibility state flexibility. This administration has tried to curtail state flexibilities that have led to greater connection for these programs to reach more who are in need and to reduce administrative burdens and costs. And the elimination of flexibilities like categorical eligibility will take away an important tool away from states and local governments who know best how to reach those in need. So tremendous threats to SNAP right now. And in this COVID context where we need to do an urgent boost of 15% to the maximum SNAP benefit, there's lots of improvements through prior COVID legislation that reached many recipients, but those who have still been left out in the cold are those who already received the maximum SNAP benefit. They've seen no added boost. And these are people who have little to no other source of income and are struggling with higher food prices and with medical challenges and other things in this COVID context. So that 15% boost is urgently needed. I'll have a slide here. I won't go through this, but it details ongoing priorities and opportunities to end hunger and strengthen SNAP Ahead. And I think as part of our panel discussion later, we might be able to touch on some of those. And I believe our slides and the presentation will be shared later. So you'll have a chance to take a look at that. My contact information is here on this slide. Welcome, thoughts, questions, happy to be a resource. And again, appreciate all of your concern and passion for addressing food insecurity. I'm really excited to hear from the other panelists and for a robust discussion, and glad to be able to join you today. So thank you so much.
Josh, thank you so much for excellent presentation. And we actually have already had a couple of really good questions for you. So we'll look forward to getting to those in our Q&A session. I want to turn now to Jennifer Craig. Jennifer, I turn the screen over to you. Yeah.
Yeah, it would help if I unmute myself. Okay, yes, I'm Jennifer Craig, and I'm going to talk to you a little bit about a school district's perspective during the pandemic. There we go. Okay, so the next slide. Okay, so first I want to start with just telling you a little bit about our school district. So we have 550 school-based employees. Those are the employees that are actually working out in our cafeterias, and 45 warehouse and support central office staff. We're a direct ship district, which means we do all of our own warehousing and delivery of our food. We have 71 school sites. And our enrollment has dropped some this year. I think that is common for most school districts. So we're down to about 54,000 this year. Garland ISD actually is composed of 3 cities. So Garland, that's the more urban area. And then we also have the cities of Saxe and Rowlett. That's the more suburban part of our district. And last year we were about 65% free and reduced. We usually are somewhere around that percentage. So next. So these are the programs that we operate in a normal year, and obviously this year has anything from normal, but I did want to go ahead and include this slide because it gives you a little bit of perspective about the diversity in our district. So in a regular year, we operate school breakfast program. We have BI operate breakfast in the classroom in 28 of our elementary schools. And these are elementary schools that qualify for universal free breakfast. We also have breakfast carts in our secondary schools as an additional point of service. We have universal free breakfast in 9 campuses. In addition, those are secondary schools where we don't do BIC. We have CEP in 24 of our 71 campuses. Usually we operate under the National School Lunch Program and offer CACFP at risk, which now we're very happy to hear that we will be able to do that this year in conjunction with the Summer Food Service Program, which we are currently implementing and have been since March. So. Okay, next. So I want to talk a little bit just about a lot of the legislation that Ms. Garrison talked about and some of the timeline and how it affected us, particularly as a school district. So next. Okay, so and March 20th is when all these waivers from the USDA came about, and it was right after spring break. So we were all on spring break, and then all of a sudden they canceled school as the unanticipated school closure, and every school district was scrambling and everyone else trying to figure out how we were going to reach our students and feed them, because as it had been discussed earlier, we know that these meals are crucial to the majority of our district. So we want to make sure that we give them access to the meals that they are used to receiving every day. So we had that National Meal Times Waiver, And also the non-congregate feeding waiver, that was very beneficial to us because it allowed us to do curbside pickup or grab and go service. The meal pattern waiver was very critical for some school districts. There was a lot of procurement issues at the beginning. Many districts were having issues meeting meal patterns. We were fortunate that we really didn't have those issues. There was a chocolate milk shortage for a brief period of time, and I think May, maybe April, but that was the only time we had to use that particular waiver. Again, it was extremely helpful. The parent meal pickup was amazing because we had so many parents that were really concerned about getting their students, A, young, B, immune compromised out, and they wanted to keep them at home and just take as few people leaving the house as possible. So that was something that I think was very crucial to families, and was very thankful for it. Also, the area eligibility waivers, that was important to us as well. Being an urban suburban district, it was important for us to be able to reach all of our district so we could assist in the suburban areas as well. So all of these waivers were extended in May through the summer till August 31st. So that helped us with our summer service as well. Next slide. And on the 19th of June, there was much, not confusion, but angst or worry over how is the USDA going to calculate our entitlement, which is basically how we get paid for next year, when usually it's based on, our funding is based on the number of meals served. And, you know, once school closed, our everybody in school nutrition's numbers just plummeted. Although we were trying to outreach to as many students as we could, it just wasn't the same as normal business. So thankfully, they decided that they would use the data from the prior year in order to calculate entitlement. So that was, we were very thankful for that. And then in August 10th, we started school a little earlier than some other districts. That was actually our first day of school. So we were really in the middle of quite a bit of uncertainty at that point, because the waivers were extended till the 31st, but we didn't know if they would be extended further than that. And we had to start school, and do we want to start school under this program or that program, or what menus are we going to use, or how are we going to do this, or how are we continue to feed students? So the first 4 weeks was virtual, and as I said, it was just an uncertain time. But then thankfully, on the day that it was to expire, they did extend the summer waivers so that we were able to continue with free meals or operating under SFSP and the other COVID waivers. At this time, it was through December, as we thought. The good part about that is although we officially started school on the 10th of August, the first 4 weeks were virtual, so we were still able to do the curbside pickup and all of that. But our in-person learning, about a third, a little more than a third in some schools of our district came back in person on right after Labor Day on September 7th. So we were able to feed them for free day one when they returned to school. So that also helped to eliminate any kind of confusion of, you have to pay for a couple weeks and then don't. We really weren't sure how we were going to manage any sort of change. So that timing did work out, fortunately, in our district. Next slide. So I have in here, this was done, my slides were done before some of the most recent news. Although I say a challenge still remains due to the uncertainty of funding. And really now this can refer to, as I talked about, our entitlement calculations, or, you know, our numbers are still very down compared to what they usually are because there's so many of our students virtual. So how will that affect us for the next school year? Or how being on SFSP instead of NSLP, how does that affect data? So there's still a lot of uncertainty and things to figure out in school nutrition. The great news is on the 23rd of September, as Ms. Garrison discussed, the House of Representatives did vote to extend the meal waivers through the end of the school year and urged the Senate to do the same. And then thankfully, again, September 30th, the Senate did pass the continuing resolution. And yesterday morning, the president signed it. So we're official. That's great news. That does give us a little more stability through the year. And it helps in our planning for sure, because that was going to be very complicated. But now what? Now where do we go? So next slide. How can you help us? Well, you can be our advocate. So as we had spoke about, Ms. Garrison spoke about, brought up reauthorization. The Healthy Hunger Free Kids Act expired in 2010, and it's supposed to be reauthorized every 5 years. And so it hasn't been, well, it passed in 2010, but it expired in 2015. And we still don't have a reauthorization act. So that's something that you can help us to get and really inform yourself on school meal issues. Contact your senators and congressmen in support, continuing commodity support, fair entitlement calculations, meal pattern. There's really a lot going on in the nutrition world right now. Also, although our programs are really evolve at the federal level, the state level is the one that implements those. So once they're passed down to the state, they're implemented by the Texas Department of Agriculture. So certainly supporting Texas representatives and letting them know to support your voice in support of school meals. Our district alone, Garland ISD, purchased over $4 million in the last year in Texas procurement. So we really do support the economy and the farmers of Texas in addition to the nation. Finally, be our champion. Please encourage those in your community to support school nutrition programs by picking up the free meals. So we have a social media campaign that we're starting that says, no, really, take the meals. And it's that basic. I think it's just dispelling the myths. There's a lot of people that think that by accepting these free meals, maybe they're taking them away from somebody else that needs it more, which is certainly not the case. Also, it helps, to clarify that it helps the school nutrition programs stay afloat. We need that. Our main job is to feed students, and we want to continue to do that, and we need to do that in order to support our program as well. Okay, next slide. And finally, if you would like to learn more about our district or school nutrition in general, I would love for you to follow us on social media. We're on Facebook and Twitter, both at GISD Nutrition, and Instagram is at GISD_nutrition. And you can learn more about the fabulous programs that are going on in our district, but also many other districts as well. So thank you very much.
Jennifer, thank you so much for that excellent overview of how Garland ISD has dealt with the pandemic. And I know is so representative of so many of our school districts that really have been on the front lines of trying to keep kids fed in our community during this really challenging time. I'm now happy to turn the program over to Dr. Hussein Lalani, who will give us his perspective as a public health physician on the impact that he has seen on food insecurity. Dr. Lalani.
Hi, Sarah. Thanks so much. Good morning, everyone. It's so nice to join you here. I just want to give a great shout out to the speakers before me, and thank you for really doing a great job in presenting the issues. I'm really excited today to talk to you a little bit more about the policy prescriptions and really the research behind some of the issues of food insecurity that we're talking about today. Just want to provide some brief disclosures. I'm an internal medicine resident physician and I work at multiple hospitals in Dallas. Today's views that I'm expressing are my own and they're not associated with any organization that I work for. As Josh really started his, I wanted to share a patient story with you really to start. I think it's important to ground our experience in this, and all of us kind of have probably know folks who've been through this. I'll share with you, a few weeks ago, I saw a patient in clinic. She initially had come in because she was feeling really sad and depressed. Her son, who's the primary breadwinner in their family, had lost his job because of the coronavirus. And she exhibited very classic signs of depression. She was having lots of sadness. She wasn't really able to concentrate. The thing that stood out to me was that it looked like she was losing a good bit of weight. And we'd kind of seen those trends in her weight. And so when I asked her about her diet, and she told me, I don't have any food in my fridge. I've been just losing weight left and right. And, to me, this was a, really touching story. It was just one of many where I've cared for patients who are really struggling with food insecurity, many for the first time. And to see the negative impacts on their life, their emotional health, their physical health, was, really, really challenging to deal with, and very frustrating given the pandemic and how it's worsened these challenges. And a couple days later, I was talking to someone else, this time virtually, about her blood pressure control, and we were talking about how to track her blood pressure accurately so that we could control it best. Unfortunately, she didn't really have much access to blood pressure cuffs or any monitoring. So we talked about other options. And one option was to purchase a blood pressure cuff. And we talked about how it was about $15 at Walmart. And she very emphatically reminded me, she said, "Hey, doc, we're in a pandemic. I can't afford anything right now, let alone trying to put food on the table for my grandson." And again, these stories are really touching, and they are the reality for many of the residents in Dallas County. I really like this picture. I wanted to share with you if you haven't seen it. It's kind of early on in the pandemic from the San Antonio Food Bank. 10,000 cars parked outside the food bank for folks really in need of food assistance. Transitioning here to kind of talking about the need, and we've talked about this a little bit, just to break it down a little bit in the numbers. Before the pandemic started in Dallas County, we had an issue of food insecurity, and 15% of our county residents, or 1 in 6 folks, are food insecure. And certainly the pandemic has worsened this significantly, doubling food insecurity for most households and tripling it for those with children. And this is data from the Northwestern Institute. They did a census household pulse survey and adjusted the data for some of the common factors, really comparing back in April and May food insecurity to back in December of 2018. So it's obviously clear that the problem has been worse. We know that when we look closely in North Texas at the North Texas Food Bank, I just wanted to highlight that we have about 40% of individuals who are getting food assistance for the first time. And these are people who have never had to deal with this, and it's a huge shock for them, and that's persisted for many folks still. And the distribution of food in this city has nearly doubled, at least in the period between March 20th and June 30th. I'm gonna skip over this section here. We had some great discussion and updates from Yang and from Josh about the policies that have been put in place to respond to the pandemic. And I'll focus on kind of two of the big policy prescriptions I think that can help tackle food insecurity. One, I would be remiss if I didn't mention the investing in the COVID-19 response efforts. The pandemic has certainly worsened this and tremendously increased the need for control. And so in terms of testing and contact tracing and really getting the pandemic under control, it would go a long way in terms of reducing the burden of food insecurity, getting people back to work, allowing them to safely use their income. Of course, this is going to be a long-term challenge for us and continuing to address it, but investments are critical in this space in order to be able to address the root cause of this, worsening of the problem that we faced. And then second, we discussed a lot about the comprehensive nutrition package with HEROES Act 2.0. I want to focus on the SNAP benefits in particular that Josh touched on and really share some of the health outcomes, the improvements in people's lives that we have seen over the years. And I completely agree with a lot of the things that were mentioned in terms of increasing access to SNAP and a lot of the social support government programs, which really are the backbone of providing nutrition assistance. And so I'll start with just a brief update on the COVID situation. I'm by no means an expert in this space, and so I'm just sharing this data to show some trends for folks, for those who may not be as up to date with the latest data, but we are, you can see the curves here for the number of cases reported over time from left to right, and then deaths and hospitalizations. And while we've seen a decrease in these numbers from prior months, we still remain in a high risk zone. And so that diligence is incredibly important in preventing this. And certainly we know that, and all of that really ties back to these worsening disparities in food access. These are the latest numbers from Dallas County just from yesterday, and showing very similar trends to the state level data here. And just want to emphasize from the Institute of Health Metrics and Evaluation that we still remain at risk for an outbreak. And overall, the numbers are improving. So if we transition a little bit more to talking about how SNAP has improved health outcomes, one of the biggest things to know here is that SNAP has kept millions of people out of poverty. And this is data from 2016 that shows us the number of people of all ages who've been kept out of poverty. So 7.3 million people of all ages, and particularly children, and 3.3 million among those who have received SNAP benefits. And it's important to note that this is really meaningful because keeping someone out of poverty means that they're able to spend their money on important needs throughout the day and their daily life that are not related to nutrition, and that'll have more effects on their overall health once they're able to have some sort of supplement. So we know that nearly 2/5 of SNAP households and even more now are at or below the poverty line. And here's a graph here showing you the breakdown from the Department of Agriculture. A lot of these data were taken from the Center on Budget and Policy Priorities, which pulls lots of national data we have from the Census Bureau and the Current Population Survey. For those who, I think on this call, everyone's really familiar with this, but just to emphasize the point that even just a small increase in SNAP, as Josh was mentioning, makes a significant difference. And this is based on evidence as well. Data here showing the impact of food consumption with just a $30 increase in per capita benefits. So we see that as we have a small increase in monthly benefits, we see more purchasing of meat, poultry, and vegetables, and less purchasing of fast food, which we know, generally is great for health. And knowing that diet is really the #1 risk factor here for mortality, which has been bared out really nationally and internationally. So now when we get into the kind of more hard data on health outcomes, SNAP participants themselves report feeling better when they have received this funding compared to those who are not eligible for SNAP. So you look at data here from 2015 on the left, about 11% of folks felt like their health was just even more excellent and than they did prior to than they did compared to folks who were not eligible for SNAP. And we see kind of reductions in folks who are reporting fair and poor health. And this kind of personal sentiment of reporting better health is really meaningful because it empowers folks to be able to do important daily activities that can further enrich their lives. Josh mentioned briefly about the specific health costs, which especially during the pandemic and with healthcare being a significant election issue and being a huge strain on people's fixed income, saving money on healthcare is tremendous. And really the thought here in this $1,400 savings among folks who are SNAP participants versus those who are not really allows people like to spend money on other necessities throughout their lives. There's also evidence that children with access to SNAP fare much better over the years. This is much older data from the 1960s and 70s, comparing folks who had access to SNAP as children and pregnant mothers who had access to it compared to those many years later, compared to those who did not. And we see that in children in particular, there's less incidence of stunted growth, less heart disease, less obesity, and even higher rates of completing school. And we know what that means for their economic opportunities and their ability to earn a living and live a meaningful life. And so I hope that through this data, you've been able to understand a little bit better about the tremendous impact that SNAP has on health outcomes, and really that these policies that we've been talking about within the HEROES Act and increasing SNAP eligibility are really based in evidence, and incredibly important for us to have the senator's support, the US Senate support here in funding this bill, really providing tremendous, hopefully tremendous access to our population in Texas and in Dallas County as well. I'm looking forward to the discussion and happy to take any questions. Thank you all so much.
Dr. Lalani, thank you so much for that excellent presentation and for also helping to focus on the integral connection between the use of SNAP, access to SNAP, and healthy outcomes for patients, and also for bringing the particular local perspective to our audience on the impact that COVID has had on food insecurity. I want to turn now to some discussion between our panelists. And as we've seen, and all of you all have touched on, and certainly Ms. Garrison touched on, how COVID-19 pandemic has exacerbated food insecurity in our country. General economic hardship, school closures we've seen, overstressed food banks have left the most vulnerable increasingly at risk. While many of us would have liked to have seen perhaps a more robust response from the federal government at this point to this unparalleled health and economic crisis, there have been moments for applause. And my takeaway from some of this so far is that there have been improvements in some of these programs that have made access simpler, easier, have eliminated some of the hurdles and barriers, which tells me that policymakers are aware of what some of those barriers actually are. I just was wondering, from your perspectives, do you anticipate that there will be any lasting changes that may come post-COVID from some of these nutritional programs, some of the benefits we've seen, like increases in SNAP allocations, like some of the waivers that we've seen in the school nutrition area, and things that have demonstrated ostensibly that families have been able to access much more readily the food that they need for their family. So I'll open that up to you all, and please jump in.
Well, I guess I would say from my perspective, some of those waivers that we received are specific to allowing things like making curbside meals easier and that kind of thing. I hope that the need isn't long lasting. I hope that we go back to somewhat of normalcy, but as long as we continue to have students that are at home virtually and not back in school, those waivers are essential to be able to get to them when they're not in school.
And I'll just add, I agree. I hope that the needs post-pandemic are nowhere near what we're seeing. I do think that there's some interesting innovations, and Yang mentioned, like with the pandemic EBT program, that has really been a new innovation. I think that there's great opportunity for looking at how that kind of model can be useful. We've looked at summer EBT to help close the gap in the summer months for many of students who get free and reduced price meals, but then don't participate in summer meals. So I think that there's some good innovations that we're seeing. Also, greater interest in hot meals to be able to be purchased by SNAP, and then online purchasing too. So I do think that there's some interesting models that we're testing out in real time that can be scaled up later. I do think we're going to, post-pandemic, still have some of the difficult political conversations about how we as a nation support these programs and what our collective responsibility and commitment is. So the work of advocates will be even more important going forward to make sure that we can invest in these successful models.
I'll just briefly add, I totally agree with Josh that, I will be interested to see the evidence that kind of bears out and seeing, how families are directly impacted with these benefits in particular, and which programs are more successful than others. And we did have this problems, tremendously even before the pandemic. So I don't think it's going to go anywhere, but we do hope that the need improves. Historically, we've seen even with the recession in 2008 that SNAP benefits track very nicely with need over time, and they do fluctuate. And there's always discussions afterward about changes and how much of this is being funded. So I think we are going to have these challenging conversations in the future, and hopefully we are learning actively from the pandemic and the interventions that are working, and maybe those that can be optimized even more.
Yeah, thank you. Much has been reported on the disproportionate impact of COVID-19 on low-income communities of color in particular, both with respect to incidence of illness and the economic impact and hardship on these communities. We've also heard today about other communities that have continued to be more adversely impacted, like college students, like working communities. We know that mixed status immigrant families have not had access to some of the economic relief that other American families have had access to during this time. And I was wondering, from your observations and from your experience, what are some of the ways that these overly impacted communities can be supported?
Well, I'll say one thing, and you're talking about the mixed status families. We didn't talk about it in the conversation yet, but some of the proposed regulatory changes, including around public charge regulations, have a chilling effect. So this would bar usage of public assistance programs, non-cash benefits, including SNAP, to immigrants and non-resident immigrants. But I think there's a fear that exists and that is ramped up by proposals like that that's really harmful, where individuals and households are in need of benefits, but they don't want to apply or take those benefits because of concern of jeopardizing others in their household. So I think there's a lot of work to do about changing public perceptions and resetting some of the public discourse around these issues. It's going to have to wait until post-election, and we'll see what opportunities are there. But there's some really harmful effects of some of these administrative actions that we're seeing.
I think we can take it back to food is really one of the best forms of medicine when it comes to health outcomes, and what we're going to have these challenging conversations. And I think one of the constant narratives that was going to be helpful, hopefully, is understanding that this is a form of keeping our population healthy, reducing overall healthcare costs, and that is going to pay off tremendously. And certainly, food justice for all is incredibly important, and we have many members of our community who are contributing members who do work, make some meaningful contribution, and yet still a lot of the injustices that we've seen from this administration pre-pandemic are going to have to be reckoned with.
Thank you. Anything to add, Jennifer?
No.
Okay. Just along those same lines, we did have a couple of questions actually from the audience regarding seniors and senior hunger. Seniors don't take SNAP because they only receive a nominal amount, the $15 amount, and some thoughts, some of your thoughts on how that might, how messaging to seniors might be improved and how their access to SNAP might be improved.
Happy to start. So I'll just note in the HEROES Act and in HEROES 2.0, among the provisions that would help with nutrition was a boost to the minimum SNAP benefit from $16 a month to $30 a month. So in the immediate context of COVID, that would be an added benefit for seniors. I think oftentimes with seniors, there's a perception that by senior individuals that they may only qualify for the minimum benefit, and that may not always be the case. So I think to have the conversation with seniors who may potentially be eligible, to not just stop at the perception that they may get a minimum benefit. And then also noting that $15 a month, while it's a small amount, also makes a difference. And if it's a senior who has to make really difficult decisions about trade-offs, about purchasing healthy food or paying for medicine, every little bit helps. And I wouldn't discount even a minimal benefit if it's going to result in better nutrition and better health outcomes.
Thank you. In our audience today, we have an army of prospective advocates, many of whom are on the front lines in serving communities that have been so impacted by the recent pandemic. We also have joining us a lot of leaders from faith institutions in our community who are also strongly motivated by their religious values to help repair the brokenness that we're finding in our world. I was wondering if you all could offer to them some suggestions. Jennifer did provide some good advocacy tips for people who are interested in working on school nutrition issues. But if you all have some other thoughts or want to share some of the best practices that you've seen effective for faith communities, for individuals, for organizations that want to help advocate on these issues.
I mean, other than sort of what I said in my slides already about being a supporter, I did see a Q&A about, you know, how can a food bank or whatever help the school nutrition program? And I would say that there's been some collaboration, not necessarily on the district level, but with the individual counselors in the schools, that's sometimes a place to go. We did at the beginning of COVID have some help and some donations with material items like umbrellas and tarps and t-shirt bags, packaging, stuff like that at the beginning. That was really helpful because we weren't set up for grab and go service at all. That's not what we do. We don't even really do a lot of catering. So that was very helpful. But a lot of the success I've seen with faith-based organizations and food pantries is directly with the counselor at the school.
Great.
And then just in terms of advocacy matters tremendously, and there's not enough public discourse about the importance of these programs and the effectiveness of these programs. We're in election season now, and for 501c3 organizations or houses of worship, yes, there are boundaries and guidelines about what is appropriate activity versus not appropriate activity, but certainly talking about these issues and prioritizing these issues when there are candidate forums, when there are debates, asking the questions of those who seek public office about their commitment to these programs, and certainly letting those who are in office now know that this is a priority. Mazone has a couple of action alerts on our website now. There's an action that folks can join to take in pushing for the Senate to respond to a COVID relief package that includes the vital boosts to SNAP. We're also working on an issue about military food insecurity, which is just a crazy issue that it exists, but there's a barrier to SNAP access for low-income military families. We've worked very hard to try and get a solution to this in the National Defense Authorization Act. Provisions in the House bill, not in the Senate bill, so we have an action alert on that too. And I think just talking publicly about these issues through letters to the editor, op-eds, raising voices from different perspectives, from those from the education community, from the medical community, from the business community. So it's not just a perceived issue about poor people, but a recognition that these programs help all of us and help our society as a whole.
Dr. Lalani?
Absolutely. I agree. I think there's two big areas on the advocacy front. We are in an election year, and our Texas senator who's up for election, John Cornyn, has a choice here to make about whether he's going to support this bill, the Heroes 2.0 Act. And I think, one immediate action that all of us can take is our phone calls directly into the office and specifically asking for him to support this legislation. And it will go a long way if all the nutrition benefits are preserved and the funding is then dispersed locally here. Another, for folks who are trying to get engaged, I think community engagement is tremendously important, and it helps people give back in a meaningful way and build those personal relationships. Earlier on the call, I saw quite a great number of our local partners and folks who are doing amazing work here. And I just want to give a quick shout out to the Oak Cliff Veggie Project and Plus Montgomery and Betty. I think they're doing some fantastic work in South Dallas with a community garden space and the veggie store as well. And there's a great opportunity for folks who are interested in a safe way to learn gardening skills, to translate those, to teach others, and also to help provide fresh fruits and vegetables in large quantities to folks. And really build those personal connections. Sometimes that helping hand, that reassuring voice, that someone who's there just to listen and provide hope is so powerful. And as we work on the larger policy reform, I think inspiring that hope every single day can go a long way.
Thank you. And I'm afraid we're going to have to leave it there. We are going to need to wrap up. I'm sorry, there's some great questions that we did not get the chance to answer, but hopefully you all will join us in the future and continue to focus on this very, very important issue of making our community more equitable, more just, and how that reflects through solving the issues of hunger and food insecurity. My final word with respect to also advocacy, what we can all do in the policy space is to vote. Our participation in democracy is critical, more critical than ever. And I'm going to end before I pass to Denise. I actually saw a very interesting mantra this morning on Dr. Lalani's email signature block. And so I'm going to leave us with that. I vote, I count. You vote, you count. We vote, we count. Thank you all very much for joining us. I appreciate your participation. Denise.
Yes, thank you, Sarah, and thank you to our esteemed speakers and panelists this morning. You led a really great discussion, and I'm excited to now encourage people to take action based on the recommendations that were provided. I do want to remind everyone that there is one more webinar in our series on food justice. So if you're not already registered, you'll have an opportunity to visit eventbrite.com and search for Dallas Coalition for Hunger Solutions to sign up for the upcoming and final webinar on October 9th, which is entitled Activating Dallas for Food Justice. So you won't want to miss that. If you're not already registered, we encourage you to visit that website to get signed on. Also, at the end of our final webinar on October 9th, you'll also have an opportunity to win Amazon gift cards. We will be giving away 5 $25 Amazon gift cards. In order to receive a gift card, you must register and attend all 4 webinars. Winners will be announced after we return from the breakout session on October 9th. Also, on behalf of the coalition, I just want to again thank the members of the planning committee for this year. They've done a phenomenal job at adjusting to the new environment, but have also done a great job at providing these webinars. I also want to recognize the leadership team and the amazing group of talented and committed leaders who appreciate and value bringing organizations and leaders together in this collaborative work. And particularly, I want to thank Stephanie Mace, Vice President of Strong Communities at United Way of Metropolitan Dallas, for being our tech guru this morning and making sure that we're continuing on with these webinars from a tech perspective. And obviously, Wyanella Henderson Green, we also want to thank her, our coalition specialist, who does an amazing job at organizing our annual Hunger Summit and keeping our collective work on track. And most of all, and probably, I just want to, again, provide thanks to you for committing and bearing with us with all the tech difficulties in the beginning of our webinar. And appreciate you guys staying on board throughout the entire session to learn and hear from our speakers. I know that you are committed in understanding and improving the relationship between food and health equity. And we hope that today is just a stepping stone for each of you on this journey to help improve hunger and bringing it to health. As I mentioned at the start of our program, we'll also be sending a link to today's recording of the webinar presentation with a copy of the slides and resources in a few days. Upon leaving the webinar today, you should be receiving a pop-up evaluation form. Please let us know what you learned and what you'll do and rate our program. Thank you all, and we'll look forward to, we look forward to for you to join us next week at the final webinar in our series on food justice. Thanks again. Have a great day.